They said it couldn't be done, but at the end of the day,
the Affordable Care Act works. It delivers.
The care you need, when you need it, at a price you can afford. It works.
I'm Vinny DeMarco. I'm the president of the Maryland Healthcare for All Coalition. We've been working since 1999 to achieve quality, affordable health care for all Marylanders. We represent hundreds of faith, community, labor, business, and healthcare groups from one end of the state to the other, and we're thrilled about the great success under the Affordable Care Act in Maryland in expanding healthcare to over 300,000 people.
Hi, my name is Nancy. I'm 58 years old, and I have health insurance. I have health coverage.
Hi, my name is Tom Friedel. I'm 48 years old. I currently work at a camp in Harford County, Maryland. I have a wife and a son, and I also have health insurance.
Hi, my name is Grace Miller. I work as a nanny, and I live with my mother, and now I have health insurance.
2 years ago, the school that I was currently working in, the school closed, and from that point on, I've had no health care. Over the past 2 years, I've had numerous hospitalizations with no health insurance. I've been on several types of different life-enhancing medications, and was not able to get medical service.
I worked for several different companies where I had good insurance, and I made a life choice to change my career to working at the campground, where I would have more time to spend with my wife, who is physically disabled, as well as my son, who is autistic. So what I did is that when I changed jobs, I had to find healthcare coverage for myself. The first coverage I found would cover me, but it had a lot of holes in it. It wasn't very comprehensive. So I got a letter in the mail saying that I had a choice, that I could go to the website and check out the Affordable Care Act.
At the beginning, I was very scared about getting my health insurance. I had had health insurance through my employer, my previous employer, made the career change, and then I was stumped. I had no idea what to do. I had never gotten my health insurance before. There was a lot of questions that I had. Pre-existing conditions was a new word for me. I had no idea what that meant.
I was in Baltimore County Public Library. I saw the advertisement for health care. They had an office, and I took a chance to go to the office, speak with a young lady. She did my application without any interruptions. She completed it, didn't have any problems with the system, and she told me immediately that I would be qualified for health insurance.
Well, my situation now is that my son has coverage. I have coverage. In fact, we have a dental appointment this afternoon. And it makes me feel very good to know that I'm not going to have an issue if I go to a doctor and have issues on whether whatever they find out is going to be covered or not covered.
Now that I have health insurance, it's cheaper for me. It's not a huge lump sum of money, and I know that I can go to the doctor now, and my premium's lower, and there isn't any kind of hesitation about what should I do, what does this cover, how much money does this cost, how much money does that cost. Everything is plain as day, and I'm under a lot less stress than I was before.
This is the first time this year that I was able to obtain all of my medications that were prescribed to me by my physician. This is the first time that I do not have to go without my medication. As of to date, I'm still under doctor's care. I receive only the best health care from my physician. I'm very thankful that I have medical insurance.
Like I said, there were questions that I had about filling out the form. And when I worked with the navigator, I found out that due to my income, my son was eligible for the M-CHIP program. It was a program I'd never even heard of before. And I actually received the card in the mail just yesterday, and we're going to the dentist today.
So basically, my whole family has health insurance because of Navigator and because they helped us.
You heard from Grace, Nancy, and Tom, who told you how the Affordable Care Act has made their lives so much better. They either had no insurance or really poor insurance and now have the kind of affordable, quality care that's great for their families and that now over 300,000 Marylanders have who didn't have it before. The Affordable Care Act is a great public health success in Maryland. And not only do the people who get the new coverage benefit, but all of us do. The expansion of Medicaid has reduced by over $164 million per year the uncompensated hospital care for the uninsured, which is in effect a health care tax on all of us. The tremendous expansion of health care to over 300,000 Marylanders under the Affordable Care Act has been a great public health success for the families like Grace, Tom, and Nancy's, and for all of us.